Well, good afternoon. I'm joined today by Larry Rohrig, the president of AFSCME for the state of Michigan, Felicia Hicks, the administrative director for AFSCME Council 25, and Joe Valenti, the president of Teamsters Local 214. And we're going to talk today about starting to bring workers back to work and the way that we've done that. And of course, Denise Fair is joining us as well. We'll start with the bad news, as we always do. As of today, we now have lost 987 citizens of this city. Almost 1 in 700 of our residents have died in a 6-week period. And while that number is 39 higher than yesterday, we're dealing with the same data issue we've been telling you about all along. A large number of those 39 are old and date back to March. So we are going to continue to show you these numbers in the most accurate format. And this chart is going to be posted every day on our website. But what this does is lists the actual day that our residents died. And what we're finding is things were worse in this late March, early April period than we realized. The hospitals were slammed with so many patients. They really were just very slow in reporting deaths, and they're still continuing to come in. But the weekly number of deaths, to me, is the best measure. This is through April 26th, so we're going to always have a day or two lag because we really don't trust the numbers from the last day or two the way they're trickling in, and we'll just keep doing this the same way every day. So you can see from the chart, 3 weeks ago we lost 234 Detroiters, 2 weeks ago 251, 1 week ago 240, and in the last 7 days 124. And so again, we are strongly on the decline side of this, and it continues to be great success in social distancing. The numbers from the hospitals are even more encouraging. The numbers I just got today, there are just in the Detroit hospitals 100 empty ICU beds and more than 500 adult beds in the city of Detroit that are empty today. There's only 16 patients over at the TCF Field Hospital, and obviously with 16 patients and 500 empty beds, it won't be very long before the field hospital gets shut down. It was a very wise thing to do because, as I showed you how fast those numbers were going up, it was absolutely the right thing to do. If they'd kept going that way, we'd have filled those 1,000 beds. But because the city has responded the way we have, and I saw Vice President Pence gave us credit again yesterday, everybody who's looking at these numbers nationally is just extremely impressed with the way the people of the city of Detroit have committed to social distancing. The numbers continue to be troubling on the nursing homes. We've now lost 214 nursing home residents, but we're seeing those numbers slow with the extraordinary intervention of our health department in the last couple of weeks. And they are now going to move on to do 37 other senior sites, and Denise Fair is going to talk to you about that. What I really want to talk about today is starting to bring people back to work. And today we're announcing that we're going to bring back 200 workers for our general services department. These are the folks who cut the grass in the parks, cut the medians, maintain the grass at the police precincts, and really throughout the city. There's 160 AFSCME members, 40 Teamster drivers. We were always, under the governor's executive order, entitled to bring back people doing public service. I had not brought them back because I wanted to make sure we had the highest standard of medical safety before we did that. And I'm going to talk to you in some detail about what we've done. Probably some of you are going to think this is boring, but I guarantee you city employees want to hear this because this is the level of commitment we have. we sat down with the union leadership here and with Dr. Rob Dunn and said, this is what we believe would make our employees as safe as possible. Our goal is going to continue to be that the 8 hours a day you're working for the city, you are just as safe as you are with your weekend activities at home. That's a high standard, but we're trying to meet it. And we laid this out, and the union leaders had a number of good suggestions. The men and women who are doing the jobs usually know better than anybody. But here's the standard that we're applying, and the 6 principles are continuing to be listing on the screen on what we're doing for everybody we bring back. But every single one of these 200 employees, most of them have already been tested, either at the fairgrounds or at our 15-minute site. All of them will be tested before Monday. They're going to have evidence of a negative test in order to be able to start work. And then every morning, every one of these employees will have their temperature checked before they're allowed to work. This is how we stop the spread of COVID-19 at the Detroit Police Department. And if their temperature is above 100 degrees, we'll refer them to medical care. We won't let them come onto the site and interact with our other employees. Now, last year, these 200 people came to work at 2 job sites, at the Southfield Yard and the Davison Yard. So you basically had 100 people cluster in to each yard. We said, no matter what we do, we don't want 100 people coming into one place. And so we are opening 5 sites, and the 200 people who reported at 2 sites a year ago will report to 5 sites on Monday. And in addition to Southfield and Davison, they'll go to Chandler Park, they'll go to the Russell Ferry Yard, they'll go to the Huber Yard. So we found a way to essentially distance by having smaller groups. Even at the Southfield Yard, that site is so tight, we said we don't want everybody coming at one time. So on the Southfield Yard, we're going to have half the employees come in at 6 a.m. so we can take their temperatures, the other half come in at 7 a.m. So we, again, are continuing to analyze every single site to say, what can we do to protect our employees every way possible? When we sat down and rolled this out with the unions, they were very positive about a number of items. But one of the things the union leaders here came to us and said, well, we've got 5 people in a truck who go out to the job sites, a Teamster driver and 4 AFSCME staff. And even with the masks, is it possible that we not have 5 in a truck? And Brad Dick and our great team went back and said, we have a lot of recreation center vans. We aren't going to be able to open the rec centers. And so we're using the recreation center vans, and we will go out to the job site with trucks and vans, so no more than 3 people are in a truck. They will be with masks. But again, we found a way to create distance, and it was a union suggestion talking about what they could do to protect their members. And these 2 union leaderships have been just very vigilant in everything that they have done to make sure their members are safe. We're going to have sanitation protocols for the thorough cleaning of the vehicles at the beginning and the end of each day, and we will have the necessary personal protective equipment. When our workers are anywhere near other workers, they will have to be wearing masks. But if you're on a lawnmower and you're by yourself and you're more comfortable, you'll be able to take that mask off and operate the equipment. But as soon as you get near anybody, we're going to require you to put that mask back on, because we know there are people who are infectious who just honestly don't know they have it because they aren't showing symptoms. We're going to make sure that when people interact, just as we did coming in here today, that everybody wears a mask. So we're going to start a little slower in the day. It's going to cost us a little more than what we are used to. But this is the way that the city of Detroit is going to bring back its workers. Their health is going to be the overriding concern. And in the coming days, I'm going to talk to you about other operations that are going to be restarted, including with some of these same union leaders, because we think there are a lot of jobs that can be done in a safe manner. And with that, I'll turn it over to one of my partners in this process, the president of AFSCME in the state of Michigan, Larry Rohrig. Larry?
Mr. Mayor, thank you. Let me just begin this by stating to you directly from a distance, a safe distance, that in my many, many, many years of doing this, this is the finest example of cooperative effort that I've seen in a long, long time. And it is through your leadership, but I'm not here to campaign for anybody or do anything political, but I want to say on behalf of my members who are alive and safe and well, it's because you were willing to sit with us as partners and direct your administrative folks to treat us like the citizens and the workers that we are. And I give you all the compliments in the word of many, many people. Sometimes the hotter the fire, the stronger the steel. I think the steel that comes out of this relationship because of what we've been through is going to be unparalleled and is going to be strong enough to get us through the rest of this. This does not come in a vacuum. The safety of my AFSCME members, the American Federation of State, County, and Municipal Employees, is across the board throughout the city employment, not only here, but throughout the country. And this is a huge step where we sit together as equals, and I won't take credit for the actual table. I will give credit to the sisters and brothers who did that. I will turn this over to my friend in a moment, one of my directors. But this came because of the mutual respect that this union, our leaders, and our members have for the process we have here in the city of Detroit. This doesn't happen every day, everywhere. There has been an adversarial situation that exists in many areas where people forget what it means to be treated with dignity. And they always want to be one up. And they want to be the one that caused it to happen. Well, an outside influence caused this to come to fruition. And it made us all realize that doing the right thing doesn't mean that you get everything you want every time you go to the table. But in this case, there was no losing. In this case, we're protecting not only the employees, but making it a cleaner, safer place for all the residents. And we're not forgetting that either. But it doesn't happen, as I said earlier, in a vacuum. I give all the credit to those brave souls who will not only return to work, but those who continue to toil on behalf of humanity. They may not be doctors and nurses, but everything they do is just as important to making sure that we have a safe place to live. And in this case, it happens to be Detroit, Michigan. The leadership of all the local unions and all the members who trust the process didn't just happen by its own volition. It happened because of the talent that works on our team at Michigan AFSCME Council 25. This is a first step, and we will not stop seeking opportunities to help the city of Detroit and also defend and protect the workers and the citizens. One of the most influential and important directors in this process is my sister and regional director of field services, Sister Felicia Hicks. Felicia, would you tell us about the process?
Absolutely. Good afternoon, everyone. I concur with President Roerick as it relates to the city's involvement in this process. We appreciate the cooperativeness, but I cannot take credit for all that's been done at the table. I have two dynamic staff reps that were involved. D'Angelo Malcolm and Mel Brabson were at the table and addressing the issues as it relates to AFSCME members, alongside of the local leadership presidents that were involved in the process. So I truly appreciate it, and it was truly a joint effort because once we collaborated, it gave everybody the different ideas that come to the table that one could not think of on their own. So I just appreciate us being able to be a part of the process at the table prior to bringing the people back to work. I thank you.
So Felicia Hicks is a very vociferous advocate on behalf of the members, and it made this better for everybody, as was Joe Valenti, the president of Teamsters Local 214. We all agreed on a single set of protocols because the Teamsters and ASPE members, they're in the same trucks. They're at the same place. We got to have a single standard that applies to everybody. We didn't have any bickering. Everybody sat down together and said, what's the right thing to protect all the workers? So, Joe?
Yes, thank you, Mayor, and I appreciate all the hard work that you and your team are doing and have done during this crisis. Since day one, we were consulted about the principles that have been put into place, and we're looking forward to getting our people back to work, Teamsters, AFSCME, and the protocols that have been put into place, we feel are going to be the safest work environment possible based on the terms and conditions that we're all dealing with. And we look forward to returning the rest of the workforce as soon as possible. But again, I commend Mike and his staff, Brad, Dick, and many others who've put a lot of work into this, and I feel our employees will be protected definitely to the best ability that they possibly can be. So thank you.
So I wanted to go in this level of detail because you're going to see a number of these start to happen relatively quickly. We need to get our roads crews on the road. Anybody who's been on the street knows what's happening with the potholes. We're also going to start letting our private contracts, and so we have vacant lot cutting. We've got major road resurfacing, and we need to get these up and running, and we are going to make a requirement that any of our private contractors, their employees, have exactly the same level of protection as city workers. They are our community as well. And we need to get going on a number of critical construction projects, particularly a number of affordable housing projects that have been sitting on hold. If you look at what's happening to us economically, I think the need for affordable housing is going to be more critical than ever. And so we are developing the protocols right now to get our construction, particularly our affordable housing projects, up and running quickly, and they will be under the same type of standards. And I'm spending a lot of time on the phone with our grocers who are already operating but are in agreement in principle that this is the kind of standard that should apply to the grocery stores in this city, the people who are handling our food. And of course, you've had some tragic losses with some grocery store employees, and so what we're proposing is going to be good for the workers and will also be good for our residents. As I said before, all of these things we could have done before under the governor's order. I think the governor's done an outstanding job. As public projects, we always could have done them under the order. We did not move quickly because we were going to make sure that we got it right. And I won't tell you this is perfect, but the thing that I'm sure of is we'll get 1 week, 2 weeks into this, and the union leaders, that we will sit down and have continual conversations. And if somebody sees something that says this has to be done better, we need to change this, we're going to work together. And all of my department heads know every month we're going to measure the infection rate of the employees in each of these departments. And our goal in every single department is that the infection rate of our employees is no higher than the community at large that isn't coming to work. That's our goal, and we're going to do everything we can to meet it. About 2 weeks ago, Denise Fair came to this session and said in 10 days she was going to test 2,000 nursing home residents across the city. Nobody in the country had tried that. We did it with the 15-minute test. They executed it beautifully. We gave you a full report of the details. People thought we were going to try to maybe not release it, but you can see exactly what the numbers are. We know they were bad before because the nursing homes didn't have the rapid tests to tell who was infected and who was not. I think you're going to see those results start to change dramatically because they are taking them seriously. Now, Director Fair and her team have identified 37 more centers in which our most vulnerable population are at risk. And if you look at who is actually dying from this disease, as the hospitals have become less crowded, we are more and more seeing the average age of those who are dying 72, 73, 74 years old. which is more consistent with what we see from the seasonal flu. And that means we have to be ever more vigilant with our elders. And to talk about her plan to now move on to the next 37 units is Denise Fair.
Thank you, Mayor. It is a hopeful time for the city of Detroit. The mayor is working to bring back several core city workers. The number of cases are trending downward. Testing has now been completed in our senior homes, and now we have a plan to address our long-term care facilities. So as the mayor mentioned, there are 130 facilities at this point, and we have prioritized based on the number of cases, and we're first going to target 37 long-term care facilities. Again, they've already shared with us that they have cases, and we want to prioritize those. We've already started calling these long-term care facilities. They're really receptive to us coming in and providing testing. So we plan to test all long-term care facilities, those 37, by May 15th, which is another aggressive time frame, but this is really important. These are seniors living in congregate settings, and we know that COVID-19 can spread really quickly. So we are, again, working really closely with these facilities. It's a couple thousand residents. So again, we will meet with them, and we'll start tomorrow. We're going to utilize the state fair grounds, so we'll conduct testing on site at the long-term care facilities, and then run those samples over to the state fair grounds. The turnaround time has been pretty quick, within about 2 days or so. So that is our plan. Not only are we going to provide testing, but we'll also provide education to the residents on basic infection prevention and more. Again, we fully expect these facilities will be receptive as our nursing homes were in receiving our support. Now, the role of the health department is to ensure safety and well-being for the entire city of Detroit. And so I think we have done that by continuing to provide education. So as of today, there are now 8,823 COVID-19 cases, and unfortunately, 987 deaths in the city. As always, my sincere condolences go out to these families that have experienced this loss. So as we navigate the world under COVID-19, it's so important for us to share information as we receive it. For quite some time, we've heard from the CDC that the main symptoms of COVID-19 are fever, cough, and shortness of breath. That is now changed. So it's really important that you know that there are now 6 new symptoms, and those include chills, muscle pain, headache, sore throat, and new loss of taste or smell. So if you have any of those symptoms, please call your doctor. You can call the health department at 313-876-4000. If you don't have a physician, we are accepting, or we have 30 physicians who are accepting new patients, whether you have insurance or you don't. We want all of our residents and business owners and those who will be heading back to work to stay healthy by continuing to follow our guidelines, which are washing your hands, making sure you're practicing social distancing, and disinfecting those high-touch objects. So let's all stay the course, because we can beat this, and we will not allow COVID-19 to defeat us. And with that, I'll turn it over to the mayor.
Okay, and so for clarification, the 37 senior sites, the Henry Ford staff, the Wayne State team, et cetera, they will be going into the senior centers, taking the samples from the seniors at their centers, in their homes, and then the swabs themselves will be sent off to the fairgrounds and out for testing, but our seniors will not have to leave their homes to get tested. And with that, we'll take any questions.
Mayor, a couple of questions from Cranes Detroit Business regarding the return to work for these workers. Of the 200 set to return, how many of those had their hours reduced? Were they in the 10% work or the?
I think in this case, I think just about all of these folks are being hired as seasonals. They were not working before. The unions can tell me better. Joe's giving me a funny look, so maybe they weren't.
I believe my 40 were on the 10%.
Okay.
They jump back and forth as seasonals between GSD and DPW.
AFSCMEs were seasonals that are scheduled to be back sooner, but are now being brought back with protocol.
So it sounds like it's a mix. We can get you those exact numbers when we announce in the next day or two the road crews. most of the people on the road crews are going from 10 or 80% to full-time. Most of these folks were not working at all. They were intended to be hired for the summer. They're seasonal, so they were intended to be hired for the summer to cut the grass. It sounds like the drivers may have been on a part-time basis, but we can get you those exact numbers.
Okay, and do you have an estimate for roughly how many city employees are at work currently?
Let's see, 2,500 in the police department, 1,000 in the fire department, 1,000 at DDOT. My office, and I don't know, I would guess 5,000, 5,500 are probably at work today, physically at work. You probably got another 1,500 working from home, something like that.
Okay. One last question from Cranes for the moment is regarding the safe workplace standards. Can you talk a little bit about the specific medical sources that helped to devise the plan, and what did the city do, if anything, in terms of running it by any outside organizations?
Yeah,
for
no,
review?
we've run it by our medical team. We think that Dr. Dunn, Dr. Zervos, and the team are as fine a group of infectious disease experts as there are in the country. And so the unions consulted with their experts. They can tell you what review they did, but we feel really good about it. And again, there are private companies out there that have very sophisticated plans. That's great. If you're interested in what we're doing, you can go to our website. You can see our main policy. You can now see what our policy is for the people who are doing lawn care. You're going to be able to see our policy for construction. Every time we bring back a group of employees, we're going to post the city policy signed off by the medical team on the site. But I keep hearing from private companies who say, I got 6 or 8 employees, what do I do? They don't have the resources to bring in a Dr. Dunn or a Dr. Zervos. And so we think we've got a good model policy that can be used. And I know you're interacting with other employers. I mean, I'll let the unions comment on what they've seen out of this compared to what they see in other places.
Yeah, this is by far one of the better standards because it was drafted, crafted, and refined with everybody involved, so we didn't have to go back and revise it over and over. We got a lot of different takes from things that are going on in other parts of the country, because our union represents literally tens of thousands of employees in New York City and tens of thousands in New Jersey and other places that were hit as rapidly and as severely. So the protocols that we've developed here fit in with the same protocols that were most effective in those areas. And I think it is kind of a standard, if I could use that word, it probably is a gold standard for a protocol in this type of work setting.
Literally, Dr. Dunn met with the union leadership. It was a conversation directly with the doctor and the employees, and he was explaining why he felt different steps were required. They would ask him, what about this, what about that, and get medical feedback on what was good and what wasn't. And so I'm not sure how many other places the workers got to engage in log meetings with the doctor, but this is the way Dr. Dunn did it at the fire department, at the police department, and at DDOT, and he's just been a godsend for us.
For the union representatives, this is from ML Elric from the Free Press. Wants to know if there have been, what's the feedback been from your membership? Have there been any concerns raised about returning to work?
Our employees are actually looking forward to getting back to work. No concerns have been raised at all. So far, so good. And I expect that to move along smoothly as it progresses.
From virtually every person that we've talked to, and we did this not in a vacuum, but with the leadership of all the locals, everybody is excited about, first of all, being protected and having safety policies and protocols, and obviously, secondly, maybe to go to work and be able to do something and kind of debug themselves from sitting around getting all jittery, because it does take a toll. So from that, and that's a practical viewpoint, that people, it's not like you get up every morning and jump up and down. I'm sure the mayor and I do, and Brother Valenti, because we love what we do every single moment. But not everybody jumps up and down every single day and goes, whoopee, I get to go back to work. But they're doing it now, because it's a different time. And it's a different mental state. And maybe people will be more cooperative now. That's what we're trying to impress on everyone. That as terrible as this is, you have a golden opportunity here to work in harmony and make your community better. So it's kind of a good thing.
All right, thank you. Question on nursing homes from WWJ. Mayor wanted to know, John Hewitt wanted to know if you have a level of confidence that the problems that occurred at the nursing homes with a lot of infection, a lot of deaths, was simply a case of testing not being available early enough and maybe information as opposed to any negligence on the part of the nursing homes.
Yeah, I haven't seen evidence of negligence. Somebody, we had 26 different nursing homes, so I can't tell you that the practices were perfect everywhere, but you are seeing this all over America. You have very vulnerable people crowded into close spaces, usually sharing eating times and the like, and you didn't have an ability to tell who was infectious and who wasn't. There's no doubt in my mind, if we had had rapid testing 30 or 60 days earlier, there'd have been a lot fewer deaths in nursing homes. But I'll let Denise Fair speak to it, but we found the nursing home directors, I mean, they were welcoming us with open arms. They wanted the ability to keep their residents safe. Did you see anything other than cooperation?
No, I was just going to jump in that they were so receptive to us coming to them and providing so much support, and it's really been phenomenal. We've been actually receiving thank you cards from the nursing home directors just saying thank you. The fact that we were able to give them PPE, that was also really, really helpful for them. So I think as we move more towards the long-term care facilities, we'll see the same.
Okay. And last question that we have is also from John Hewitt at WWJ. Mayor said he heard you on a session today with the chamber, and I think you had said something about this being a marathon and not a sprint. And you want to know if you could talk just a little bit more on that in terms of what the community should expect to level set their expectations.
Here's what I believe. We are going to be living as a country with COVID-19 in July. We're going to be living with it in September. I believe we're going to be living with it in January. If there were a vaccine developed by January, it would be a medical miracle. And they're working on it, and I hope they do. But I think the reality is that we are going to be dealing with this risk in our community for another year and maybe longer. And so we can't just stay locked up in our houses for a year. And we have to figure out how to interact with each other in a way that keeps us safe and reduces the spread. And as long as the doctors and the hospitals have the capacity to deal with a relatively small number of cases, the quality of the care is dramatically higher than when people are laying in gurneys in the hallway, which we had 3 weeks ago in lots of parts of this country. So that's what bending the curve was all about, was to make sure there were the resources to give proper care to anybody who needs it. At this point, the doctors can spot the symptoms much more frequently. The doctors, they actually don't need the tests. The nurses at this point, they know what they're looking at. They know how to treat it. They know which symptoms tend to go south faster. They know so much more than they did 6 weeks ago. We are going to have to figure out as a society how to interact with each other in a way that when we're infectious and we don't know it, we're still protecting our neighbors by wearing masks, keeping distances, and being respectful. And that's what this is about. That's what this announcement is today. I am sure in October, all of these employees are still going to be wearing their masks, getting their temperatures taken every day, unless there is a huge medical breakthrough. I expect the same thing we're announcing in April is going to be the practice in October, and I think people should be getting ready for that.
All right, that was the last question.
All right, thank you all very much.
怎么又晚了？
这诊所太远了，这里多开几间就好了。
政府里需要有我们的人，需求才会被听到。
哎，你这……哎，你们两个都对，可光说有什么用呢？填好2020年的人口普查，就可以协助公共资金的分配，比如地方医疗，更多的政府席位。想要给自己发声啊， 赶紧上网填，打电话也行。
请上2020census.gov 完成普查。